In today's video, we'll look at 6 signs of a silent heart attack that can't be ignored. Did you know that between 20% and 45% of heart attacks occur without any obvious symptoms? That's right. Contrary to what you see in the movies, a heart attack is not always dramatic. Often, the signs are discreet, almost imperceptible, or even absent. That's why it's essential to be aware of any changes in your body. In this video, you'll understand what a silent heart attack is and how to recognize its signs. But what is the difference between this type of heart attack and the common heart attack? In the case of a traditional heart attack, also called a heart attack with symptoms, the signs are well defined, including chest pain, shortness of breath, excessive sweating, nausea, and vomiting. These symptoms are usually intense and start suddenly, indicating that the heart is not receiving enough blood. In a silent heart attack, as the name suggests, the signs are mild or even non-existent and can be mistaken for other health problems. Many people don't even realize they've had a heart attack, which can be dangerous as it increases the risk of serious complications, such as sudden death. Despite the differences in symptoms, in both cases the heart muscle suffers damage, requiring immediate medical attention. Early diagnosis and appropriate treatment are essential to avoid complications and save lives. But how does a silent heart attack happen? It occurs in the same way as a common heart attack, but without any clear symptoms. The main cause is the obstruction of blood flow to the heart, usually due to the buildup of fatty plaques in the coronary arteries, which are responsible for carrying oxygen-rich blood to the heart muscle. This buildup of fat leads to atherosclerosis, a condition characterized by narrowing of the arteries and impaired blood circulation. Over time, these plaques can become more rigid and even rupture, causing inflammation and the formation of clots, which can block blood flow to the heart. Why is it so important to recognize the signs of a silent heart attack? Because this condition can go unnoticed and lead to serious complications, including sudden death. Studies indicate that silent heart attacks are more common than you might think, and many people can suffer a cardiovascular event without realizing it. According to the World Health Organization, cardiovascular diseases are the leading cause of death worldwide, accounting for around 17.9 million deaths per year. In Brazil, it is estimated that more than 300,000 people die every year from cardiovascular diseases, including acute myocardial infarction. In addition, research shows that silent heart attacks may be more frequent in women than in men and may be associated with an increased risk of new cardiovascular events, such as future heart attacks and strokes. It is therefore essential to pay attention to the body's signals and seek medical help at the slightest sign of discomfort, especially for those with risk factors such as hypertension, diabetes, high cholesterol, smoking, and a family history of heart disease. But what are the 6 signs of a silent heart attack? Excessive tiredness, feeling fatigued for no apparent reason, even after a good rest, can indicate that the heart is not working properly, as it needs to work harder to compensate for poor circulation. Shortness of breath, difficulty breathing, even at rest or after light activity, can be a sign that the heart is not getting enough oxygen. Nausea or stomach discomfort. Some people experience nausea, indigestion, or stomach pain during a silent heart attack, especially women. Pain in the arm, back, neck, or jaw, pain in places other than the chest can be an indication that the heart is not receiving enough blood. Cold sweat and dizziness, feeling weak, dizzy, or breaking out in a cold sweat can be a warning sign of a silent heart attack. Insomnia or anxiety, changes in sleep, insomnia, or bouts of anxiety can be a reflection of the physical and emotional stress caused by a silent heart attack. Now you're probably wondering, is it possible to prevent a silent heart attack? The answer is yes. Some measures help to reduce the risk of cardiovascular disease and, consequently, silent heart attacks. Eating a healthy diet. Eat a balanced diet, rich in fruit, vegetables, whole grains, fish, and lean meat, avoiding excessive consumption of saturated fats, sugars, and salt. Physical activity. The recommendation is to do at least 150 minutes of moderate physical activity or 75 minutes of intense activity per week, such as walking, cycling, or swimming. Stress management. Adopt stress-reducing practices such as meditation, yoga, breathing exercises, relaxing activities, and hobbies. Regular medical examinations. Monitor heart health, especially in people with risk factors, by carrying out tests such as blood pressure checks, cholesterol and blood glucose tests, and electrocardiograms. Following these recommendations can help prevent cardiovascular disease and reduce the risk of a silent heart attack. However, each person is unique and prevention strategies can vary. That's why it's always important to seek medical advice to identify the best practices for your health. We hope you've learned more about silent heart attacks and how to identify their signs. Remember, prevention is the best way. Take care of your health and pay attention to your body's signals. If you know someone who could benefit from this information, share this video. And don't forget to like and subscribe to our channel for more content like this. See you in the next video.